All right. Hey ho, let's go. This is Resistance Radio, where natural selection selects resistance, and apparently unregulated capitalism is giving the Cyclospora parasite a fighting chance. So we need to talk about Cyclospora again because this story has gotten much bigger. More than 24,500 Americans now have confirmed or suspected infections. Two people have died, and I assume likely more as well. Now, cyclospora is a parasite that spreads through food or water contaminated with human feces. It can cause diarrhea, cramps, nausea, and an illness that can drag on for weeks. Now, one enormous cluster has been traced to iceberg lettuce from a Taylor Farms facility in Mexico. And that's where this story actually gets interesting because we know a lot more about what happened behind the scenes. Okay, so suddenly this looks a lot less about a story of contaminated lettuce and a lot more like a story about what happens when public health costs somebody money. Now, in Michigan, investigators noticed that many people getting sick had eaten at a Taco Bell restaurant. So on July 1st, they asked Taco Bell for its supply chain records. Then again on July 3rd, then again on July 6th. Eventually, the FDA had to get involved, and investigators finally had all the records they needed on July 13th, nearly 2 weeks later. Now, here's the kicker. A federal food traceability rule was supposed to take effect this January, requiring companies to provide this kind of information within 24 hours during an outbreak investigation. Now, instead, the Trump administration actually delayed this rule to take effect until 2028. Now, the FDA argues that having that rule in place won't necessarily have substantially changed this particular outbreak. Fair enough, but it raises also a much bigger question. When something goes wrong in public health, how do we tell the difference between bad luck and bad policy choice? And that's where I've developed Dr. Derry's 4 public health principles. There are 4 questions I ask. There are 4 questions I think we should ask whenever government makes a decision that affects our health. These are not complicated questions, just questions that force us to follow the consequences. So let's try them here. First, question number 1, does the policy increase protection? Well, does delaying that rule specifically designed to help investigators find contaminated food faster, make us no protected? No. Whatever benefits delaying the rule might provide businesses, increased public health protection is not one of them. Rule number 2, was the harm foreseeable? Well, of course it was. We've known about cyclospora for decades. Congress passed the Food Safety Modernization Act in 2011 because we already knew our system needed better prevention, inspection, and traceability. Now, here's the incredible part. The FDA investigated this exact Taylor Farms facility after another cyclospora outbreak in 2013. Pathogen is not new. The vulnerability wasn't new. Even this facility wasn't new. We knew the problem existed. What makes this question important is who bears the burden of the policy. And this is where our lettuce story suddenly becomes a story about capitalism. Because traceability costs money, inspections cost money, testing water costs money, keeping records costs money, and capitalism gives businesses a very clear incentive: reduce costs, increase profits. And again, that's not a conspiracy. That's the business model. But when regulations designed to protect us become one of those costs, capitalism creates an incentive to weaken them, delay them, or even just frankly fight them. Now, here's the part we sometimes miss. Getting rid of the regulation doesn't get rid of the cost. It just moves it. It shifts it. A company avoids a compliance cost. Somebody down the line gets sick, then they miss work, or somebody then ultimately gets hospitalized. Public health departments have to scramble. Taxpayers fund the investigation, and the company saves money. We are the ones that pick up the bill. Economists conveniently call that externality. But I have a simpler version. The market is very good at deciding what lettuce costs. It's just terrible at deciding what diarrhea should cost and who should pay for it. And this brings us to our 4th and final question. What does the evidence say? The answer is actually important because Cyclospora really is difficult. It's hard to detect in water. Chlorine doesn't reliably kill it on produce. There are scientific problems in how that we have genuinely have not solved. But scientists have repeatedly asked the federal government for about $10 million to develop better detection and testing. And that research, as of today, remains unfunded. And inspections, the Food Safety Modernization Act envisioned, listen to this act envisioned 19,200 foreign food inspections annually. However, last year in 2025, the FDA conducted just a mere 1,100. The FDA hadn't inspected this particular Taylor Farms facility since 2019. So, yes, science has limitations, but there's a very important difference between we don't know and we haven't invested in finding out. So now we've answered all four questions. Let's go over them again. Did delaying these protections make us safer? No. Was the danger foreseeable? Yes. Who bears the burden? We do. And does the evidence suggest we simply had no tools available to do better? No, we had tools, research, and protections we chose to delay or underfund. And that is the diagnosis. This wasn't simply an unavoidable encounter between humans and a difficult parasite. Policy choices helped determine how prepared we were when that parasite showed up. And those choices reveal something much bigger. Capitalism and public health are fundamentally incompatible unless capitalism is aggressively constrained. Let me say that again. Capitalism and public health are fundamentally incompatible unless capitalism is aggressively constrained because they are trying to optimize for different things. Capitalism asks, how do we maximize profit and minimize costs? Public health asks, how do we minimize illness and protect as many people as possible? Sometimes those goals overlap, but the moment protecting people becomes an expense that threatens profits, the conflict becomes unavoidable. And successful public health produces something capitalism is particularly bad at valuing. Nothing happened, right? Let me say that again. Successful public health produces something that capitalism is not good at understanding and valuing. And that is that an event, nothing happened. Nobody got sick. Nobody went to the hospital. Nobody died. The contaminated lettuce that never reached your taco doesn't appear on an earnings report. And that's why we have regulation, because sometimes the thing standing between corporate profit and your intestines really is a government inspector with a clipboard. So here's what this Cyclospora outbreak teaches us. We knew the threat. We knew our food safety system had weaknesses. We created rules to strengthen it. Then this was delayed by some rules. It was underfunded. Research was underfunded and conducted only a fraction of the inspections that Congress once envisioned. When people get sick, the costs don't disappear. They land on us. That's not capitalism malfunctioning. That's exactly why capitalism requires limits, because public health cannot succeed if protecting people is always required to justify itself against the cost of protecting them. This is Resistance Radio, where natural selection selects resistance, and where this Cyclospora outbreak reminds us that when public health threatens profits, capitalism protects the profits, and the rest of us ultimately get the bill. Thank you so much for tuning in.